it will hopefully be a series of webinars in which we will have speakers, international speakers, some students who are working for the sake of disaster management, and other people who are willing to speak. I welcome all participants here with our honorable guests or speakers for today. Disaster management, I just want to say that everyone here knows about what's a disaster now. Everyone knows how a disaster is working, what kind of disasters there are, man-made disasters or natural disasters that are happening. But one thing is, recently we have been struck by a disaster named as COVID. We weren't prepared for it. We had no idea what this disaster will be doing. We still don't have any idea. But the purpose and the ideology behind this webinar was, why not have all the medical students on one page? Because medical students or the to-be doctors or the doctors are the first line defenders against COVID. So why not have some ideas from them? What are they lacking? How are they working? What kind of ideas do they have for future planning and all? Starting from the basics of disaster itself, disaster is basically an unforeseen event which can overwhelm the capacity of affected people to manage its impact. Now, many people periodically are exposed to natural disasters in life. We have seen so many disasters. Let's take, starting from the country we live in, we had floods, we have earthquakes, we have other disasters that were man-made, and so on. Now, more correctly, the hazard disasters cannot be prevented. We cannot prevent it at any cost. We know like they're coming, but we cannot stop them from coming. The thing is, we can mitigate the effect of the disasters. Disaster management efforts aim to reduce or avoid the potential that are losses from the hazards, to assure prompt and appropriate assistance to the victims of the disasters and achieve a rapid and effective recovery. Now, all of this is what we can do, what we have learned from the disasters. But now we have honorable speakers here on the panel that will tell about what disasters are, how they're working for the disasters, and what we as medical students in their perception can do. My first speaker on the panel is Ma'am Sana Basi. She is staff nurse at, pardon me for saying the name, at Hadassah Hospital Emergency Department, and she has high diploma in emergency room. She's now studying for a master degree in disaster management, and she belongs to Jerusalem. Hi, ma'am, how are you?
Hi, how are you?
I'm good, how are you?
Fine, thank you.
Okay, let's begin with a series of questions that I've planned for you, and let me ask you, and then we'll see how we made a conclusion for the medical students at the end. Can you share about your experience so far?
Okay, as you mentioned, I'm so happy to share your webinar today. I appreciate this. I appreciate your invitation. As you mentioned, I am Sana Abbasi from Jerusalem, Palestine. It has been 13 years since I'm serving as a nurse. I'm working in Hadassah Hospital in emergency room since 5 years. And 2 years ago, I finished my specialty in emergency. I did a high diploma. And now I'm as a medical student in Tel Aviv University in public health, emergency disaster. And now I'm working on my research topic under the title of Resilience of the Medical Healthcare doctors and nurses who's working in the corona unit and other in comparison to another units which in dealing with coronavirus.
Thank you so much, ma'am. More power to your great work. So as you said that you're also working, can you tell about your experience as a first-line defender against COVID? Because in disaster medicine, we know that there's some kind of pressure for the workers that are first-line defenders. Sometimes they're not prepared for it if they do not know, because medical personnel, they can control situation in ICUs and in emergency rooms, but sometimes they're put into such situations where they get a little panicked. I wouldn't say the word panic is too strong, but they get the pressure on themselves. So you're working as a first line defender. How was it for you for at the start? Did you get prepared from your medical college or the hospital you're working in, or what was your experience?
Okay, as you know, I'm an emergency nurse. I will give you an example about my hospitals. There we receive any patient that's suspected with corona that has any symptoms like fever, cough, runny nose, maybe shortness of breath, tiredness, and another symptoms. Everyone that are suspected to have coronavirus, we open in the emergency room a unit which called biological unit, respiratory unit. Anybody that are suspected, we enter them there. We take blood test, vital signs, chest x-rays, a corona swab, PCR for corona. And if he need admission, we should wait to the result, and sometimes it may take, might be out in 24 hours or more, depend on the workload of the lab. If he need admission, he should wait there in the unit, and he can get all of the medication that he needs. And if the result is positive, we transfer them to or him to corona unit. And if the result is negative, he should and he need admission sure in another unit, he go to the suitable unit like surgical unit, medical unit, pediatric unit. And if he didn't need admission, we can discharge him home, and he should be in home isolation until further notice.
So yeah, that's pretty much what every workers and much every government is doing out. So since you're also studying disaster medicine as a master student, did you somehow picked any loopholes in the COVID response in your country? Because you were studying it, did you like pick out like what could have done better if you were there, the in charge or making decisions, or what were there if the medical people around you, the doctors and other nurses, would have told how to respond in such situations, if they were prepared for any disasters and stuff like that?
Okay, now in our hospital, I think there is no major obstacles because we follow the WHO and the Ministry of Health guidelines, protocols, and standards. So we didn't until now, because the number of corona patient in Jerusalem is not as that worldwide, like Italy or Spain. The number is more, but here it's controllable. We have sufficient protective measurement like gloves, masks, and gowns. We are wearing and using the protective measurement, and a new guideline was done in our hospitals. The hospital provide us with the scrubs. We shouldn't go with our private uniform. The hospital provided us with a suitable scrub to prevent the spread of infection. And but I can tell you, like another countries, the people are still ignoring the official advices about self-quarantine, to stay home, to maintain appropriate hygiene and method, and panicking in the social media. There is many fake news. They follow this fake news, and it may cause a panic, or they will be afraid. And in like another healthcare workers, we are afraid. We are working long hours in the hospitals, maybe sometimes 12 hours shift, and we are frightening to contract the virus, to spread it to our family when we returned home.
Just another question popped up in my mind when you were telling about how you're working long hours It's the same in my country. Doctors work long hours. The hospital management don't give them an edge for that. But I've hearing from other people in most developed countries like US, where there are more residents. But the thing is, even they are having this pressure and then working beyond their boundaries. So did this somehow shrunken your mental health, or did it affect your what do you say, physical stability, or like did it give you any trouble, something like that, like working for long hours?
Yes, it's a hard situation because the virus is new. Nobody know about this. Nobody know about the contagious, that the long time that the virus will spread or will maintain in the world. We are it's I it's a really afraid thing. We are under pressure, under it's caused sometimes mental discomfort because due to as I mentioned, long hours. We are afraid to contagious our family, to spread the virus to him. And but we should be brave, because the virus is one day it will be finished, and we will finish with this. And for sure we should be like a role model. We should give communication, safe caution for the people. We should spread our knowledge, our preparedness, the importance of preparedness in facing like hazard and disaster like this disease. And
Okay.
should be aware.
Thank you, ma'am. I will.
And we should be aware of the latest information of the COVID-19, and sure maintain good hygiene. It's very important to maintain good hygiene.
Okay. I will shift some of the questions to the other speaker we have on panel. He's Alamzeeb Hikmatyar Khan. He's a third-year medical student from Sedu Medical College, and he's also a superintendent to assistant in the response. He's now developing a policy with the district health officer of Sawat, that's the region of Pakistan, and medical superintendent Sedu Teaching Hospitals for Division and Malakand. Hi Alam, how are you?
Hello. Hey Maha, assalamu alaikum. How are you doing? Great program so far.
I'm good. How are you?
Very good. I'm very good.
Great. So what are you up to these days, Alam? We know that you're a medical student, and then you are doing some very great work that is an example for the medical students out there who think that they could not take any part in this disaster situation. So let me start from the basic questions, like what are you up to these days?
So right now I've been sitting in front of my laptop all day working on this policy paper. So the basic idea is we want to make a paper policy for the whole district to follow, with the supervision of the district health officer and the medical superintendent, who both have their masters in public health professions and diplomas, additional diplomas, etc. So they have the full experience, and I have the experience from working in the New Jersey Department of Health as an EMT, and the Federal Emergency Management Agency. I got additional trainings as an EMT in the Incident Command System, National Incident Management System. So we're using those documents to compile and make this, and it's stressful, and I can't lose any more hair, but you never know.
Yeah, that's really great that you could utilize what you've learned so far in the area you're working in. We know that being from a country like Pakistan, it's developing. Everyone can pull in. There are people out there, sure, they're working in their capacities, but how can we outreach our hand for them, for their support? Because in this matter, since as ma'am said that COVID is still new to us, no matter how much research is being done, it's still going on. We cannot like implement anything as for yet, but we can stretch out our hands for the people who are working in their capacity to like get rid of it in a shortest span of time. So another question with like for knowing you better and what you're doing for the participants that are out here, how did you get involved in this in the first place, and what's your role in this?
So what ended up happening is one of my professors reached out to me and we were talking about the coronavirus response, and he knew that I have experience in the emergency medical system and the health field in the US. So they called on me and I came through, the Army block, which was kind of cool, like, showing them the letter and everything, and got through there. And I met with the medical superintendent. The initial phase was assessment, like, what exactly is going on? What are we doing? What are we not doing? And me also setting my base there. I'm new here. I'm the only volunteer, and it's kind of a different thing that's going on. So we end up going through, and a colleague of mine, Mohammed Siddiq Khan, he also pitched in his effort of giving us access to his cloud network and making a framework for us to start using our reporting system, as we have a new pathology lab here set up by the pathology department of Sadie Medical College. And try to get the division samples. All the division samples will be sent there, working on the reporting protocol, again getting everything down on paper. Basically my role is to work with these administrative officials and to make a policy that we can actually work on, because like you said, this is something new. It's not something we've dealt with before. No matter how many policies and papers we have previously, they were already in effect when this started happening, right? So how does it, how will it work where we have the old system, which isn't currently working? But the idea is right now to get, from the incident command system 200 training, to get those documents, compile them, cut them down, condense them, and make them specifically function for us, right? So the concept is that we integrate our communication system, the public health officer, the district commissioner, the district health officers, we all have a function and a form to follow. I report to this person reports to that person. Everything is available. The data is online for everyone to see. The communications are clear. There's no confusion about the chain of command, right? You want to make a system that's easy for us to follow and that also mitigates user error, right? Which is us. So we have standardized SOPs, standard operating procedures across the board that everyone follows, and that we can then, streamline our system and have it function better. Because one of the main issues is the communication, right? If we're not communicating properly, the information is getting out, patient privacy is being violated, right? The things are getting messed up because we have, maybe some issues sometimes in keeping the intelligence together and whatnot. So having a standardized approach, which FEMA has, supplied for us, making an actual operations plan down on paper, hard copied for us to follow across the whole division and district, will make everything much more streamlined, because the patients won't be getting sent here or there, doctors won't be complaining about PPE. We'll have full span of everything from our logistics, from the paramedics to the, the clinicians, head to the HODs. Everyone is on the same page, using the same communication guidelines. We have clear defined roles, right? Instead of, for example, you're doing this and and doing that, but I'm also doing one of those things and I'm doing my other thing as well, right? We have redundancies. One of the big issues is redundancies, right? So yeah, so streamlining, making
So
everything
there comes
better.
my another question for my participants that are here, because my sole purpose of this thing is that for our participants to learn more where to start from. So what strived you to work for it? You were sitting at home, you thought, why not work for it? What happened to you? What was your first move, and why was your first move?
So I was discussing with one of my teachers on WhatsApp, what is the current response going on? What is the plan? What's the plan, right? That's the first question we always ask. So we were discussing what the plan was, what we're doing good, what we're doing bad. And then he recommended me to the medical superintendent. And then I came from the letter. And yeah, I mean, if you know something, try to help out. If I have the trainings, I have the knowledge necessary, I have the references I can use in the framework for from something that's already established. Anybody, anybody can do it, yes, but it's difficult, but it's doable, right? If you have an idea, reach out to somebody and throw in your pitch. If they don't listen, it happens, but
We will take questions later on, but we have some questions popping up. Before going to the questions from the participants, how can medical students take part in such an initiative? You said that if you have an idea, reach out, but some people wouldn't know who to reach out to and what to do. So can you properly tell them a channel of working through your experience and your areas of expertise, so they can know that what happened with you, how they can at least take their first steps, since everyone has to work and the more the merrier. So where do we start?
So, I mean, it would start from you have a member of the staff in your medical college, or you have somebody you know who's working in it. If you have like, an actual, like, a nice approach, something you really thought of that you think can be of assistance, then talk to somebody who you think can pass you on or discuss further with that person. And they'll, tell you about the feasibility, because it also comes down to, we don't want to jam up the system, right? Like the whole idea of an incident command system and like the division incident management system is to make roles clear cut, to cut out like, any subsectors and everything. But like ideas, you can email, you can talk to your teachers, you can talk to your friends, house officers, TMOs, all healthcare professionals are involved right now, even if they're a paramedic as well. Paramedics are very important in this time. The technicians, the lab technicians, everyone is taking a part in this, and everyone has the general guidelines and ideas, and they'll give you an idea of what is right, what is wrong. And then, use your references, right? The Federal Emergency Management Agency has a lot of guidelines available online, the CDC, World Health Organization, there's a lot of references you can use out there. I'm using multiple researches to formulate the policy and everything. But if you have an idea, start working on it or start writing it down, get in touch with somebody.
Great. Thank you for the answers. Now, as you said that you are mitigating the response, you're policy, and then there comes another thing in my mind, that it's very crucial at this point that the hospitals remain safe and functional during and after the disasters. This is the preparedness, and then even in the mitigation thing. Now, health facilities at all levels deserve special attention in the case of the natural disasters, and they must continue to work for the current patient treatment within their facilities and provide care for the persons injured, in this case, the persons affected by the disaster. Now, disaster management becomes even more important for hospitals as the health sector has been particularly vulnerable to the damage it has caused. Moving back to our first speaker, Ma'am Sana, I have some questions again for you. You're here, right? Hello.
Hello.
Great. Yeah. Okay. Great. So, some questions that were lagging, like in the flow of disaster management, since the other speaker told us about how it's important, how the mitigation, how the preparedness is important, but this is a different kind of virus that we had this time. So what was the response? For example, you told about the response, you didn't lack any of the resources, your country was well prepared for the disasters that are all there, and even for this kind of disaster that we didn't have any knowledge about. So is there still anything that you think could have been better, or it could have made a difference?
I think we should follow information that posted in CDC, WHO, ensure and information that will be correct and sure. And we should, I think, because this disaster or this the COVID-19 cause maybe the healthcare are afraid. So we should offer medical health team, psychological counseling services, and more support to give for him. I think because there's less of number of respirator in the worldwide, so we should maintain more number of respirator for emergency catastrophic cases. We should build clear strategies to face natural or other kind of disaster, and we should do, it's very important to do family plan, to build a go-to-kit like we called here in our community.
Okay, that's a great idea that the governments should take an action from. But yeah, they could help with the mental health, they could help with but most importantly, what I took notice from, or what I took a note from your what you said was, listen to what the organizations out there are saying. Listen to WHO, listen to other organizations that are working for public health in your countries, because they know better than any of us out there. It's, as you said, it's useless to panic, because panic would not do any good to us. Only listen, like follow proper rituals that they have said, follow the proper hygiene, and then we can tackle mostly this germ known as COVID, or the virus, sorry, as Donald Trump says, the germ. Now, another question coming up from the question that was previously asked, what shall be the role of doctors in it? I'm sorry, I'm keeping on asking the same questions, but I think that if I mold the question here or there, people might get the crux of idea, like what we're trying to explain, why we are hearing, because there are a lot of people out there that are talking on the COVID, that are talking about what this virus is, how can we prevent it, what can hygiene do. But this, the idea of this webinar is totally to tell the medical students who are going to be the doctors. We pray that we do not see any virus like this in the future, but we should be prepared. We should know, or we should make the most out of this quarantine in which we are in. We should learn about it. We should know how to work for it, how to even work for the government, how to help them or anyone out there. So what would be your message for the students that are studying medical sciences especially, and other students that are also studying disaster management as a subject? So a little message for the medical students, and then for the students that are studying disaster management.
In my spot, it's a really interesting topic to learn about such a topic, and you will find yourself thinking differently once you finish this course, and it's well to start to know aspects of life in different ways, and to find yourself know a lot of plot twists, and it's a chance to learn about previous natural and human disaster, and to take lesson from those disasters, and to be well prepared for the upcoming disaster. And it's a highly appreciated to know about humanitarian and actions, ethic in disaster, legal aspects, and it's very, as I mentioned again and again, it's very important to build a family plan.
That's great. Thank you, ma'am. Now shifting some of the questions that are left to the speaker, another speaker on the panel, Alam. I have some questions, and then we will ask a couple of questions from the participants, and then we move to the end of this series. Hopefully, we will have next series for interaction with the participants and the medical students. Alam, can you see me now?
Yes, I can see you.
Great. So moving to the questions that I have left for you. Again, my foremost topic of importance: what can the participants do? And how can you answer an infamous question that is out there, that does the government even need your help? Because some of the parts, if I were the participants, I would have asked that the government